Hello and welcome everyone to our Advocacy Committee webinar today on women in leadership across industries. This is the 8th webinar in a series of webinars that the APPNA Advocacy Committee will be conducting throughout the year. We continue with the APPNA mission of promoting healthcare-related advocacy. My name is Dr. Samina Qureshi, and I chair the APPNA Advocacy Committee. As well, I'll be conducting and moderating today's session. We are very honored to have some very distinguished women leaders with us today, Lieutenant Governor of Maryland, Aruna Miller, as well as Lieutenant Governor of Virginia, Governor Ghazala Hashmi. So thank you so much. Before we begin, just a few words. I'd like to also introduce our president of APPNA, Dr. Barbara Rao. Dr. Barbara Rao, would you like to say a few words?
Thank you, Sumina, for organizing this. And thank you both the Lieutenant Governors giving us this opportunity to have a conversation with us and guide us, what you think should be done. And on a lighter note, I'm sitting at the airport going to Dallas for Japan versus Holland FIFA game because my wife is from Japan, so I have to do this. But I welcome everybody and let's listen in what we need to do. So thank you, Samina.
Sure. So before I begin my introduction of these very distinguished women leaders, I'd just like to give a brief acknowledgement and thank you to Ms. June Laffey, the Chief of Staff for Lieutenant Governor Ghazala Hashmi, as well as Ms. Rachel Savicki, the Director of Communications for Lieutenant Governor Aruna Miller. So without these ladies, it would have been very difficult to sort of coordinate today's session. So I'll start off with the introductions, and then I will continue the conversation with a set of questions that our membership is interested in, listening from both lieutenant governors, and then we'll conclude the session with a brief period towards the end. We'll open it up to a quick Q&A from the attendees. And so let's begin. First of all, thank you again, ladies, for your time. We know how busy you are, especially on a Saturday morning. So I'd like to introduce Lieutenant Governor Aruna Miller. She's Maryland's 10th Lieutenant Governor and the second woman to serve in this role. She's the first woman of color and immigrant elected to statewide office in Maryland. By way of profession, she's a civil engineer. Before becoming the Lieutenant Governor, she served as a transportation engineer and represented Montgomery County in the Maryland House of Delegates. In the Maryland Council, she chairs the Maryland Overdose Response Advisory Council and oversees the Maryland Office of Overdose Response. She's a strong voice on issues including transportation, overdose response, and mental health, a champion for STEM education and expanding opportunities for all Marylanders. So welcome, Lieutenant Governor Miller. And then I'd like to introduce Lieutenant Governor Ghazala Hashmi, who I'm very pleased to welcome. She's the 43rd Lieutenant Governor of the Commonwealth of Virginia. A trailblazer as well, she's the first Muslim woman to be elected to any statewide office in the nation. So a first. As well, she's the first South Asian American elected statewide in Virginia. Lieutenant Governor Hashmi has spent nearly 30 years in higher education, where she was teaching literature at the University of Richmond before being elected in 2019 to her first term in the Virginia State Senate. So she has, while in the Senate, she has focused on strengthening public education, expanding access to affordable healthcare, which my audience is greatly interested in. Both of you ladies, how you participate in health care related matters. As well, she has done efforts to protect reproductive freedom and advance economic opportunity. During her tenure, she's played a key role in securing historic investments in higher education, as well as, very importantly in today's environment, defending civil rights for all Virginians. So absolutely want to thank you from the APPNA community, myself as well, being a resident of Maryland and near Virginia. Thank you so much for your time. So we'll start off with a few questions, and I'd like to hear from either one of you. You can chime in if you want to answer this, but of course I'll give an opportunity for both of you. Very importantly, relevant to today's conversation is we know that women remain a minority in many executive roles still in this day and age. So, what strategies do you use to elevate, mentor, and advocate for other women stepping into public service? Perhaps I'll start with Governor Hashmi.
Well, thank you so much, and thank you for the kind introduction. Thank you to everyone who's joining this webinar. It is a real pleasure to be here, certainly an immense pleasure to join my friend and colleague across the border, Lieutenant Governor Aruna Miller. And it is such a critical question that you're posing about how do we make sure that there's so many more opportunities for women to engage in these public spaces. One thing that I'm excited about is that in Virginia, we are consciously building more opportunities for young people and especially individuals from underrepresented areas to have more engagement with state government, with local government, to understand the ways in which policy decisions are having an impact on their lives and their communities. So I'll give just a couple of examples. You know, we have just started an internship program here in Virginia. It was something that I worked on during my time in the state Senate, and we are now seeing it up and running. And this is a chance for paid internships within our state agencies and our departments. And it just opens the door for so many young folks who previously, of course, without paid internship, they have to spend many months working rather than having the opportunity to intern in areas that are of interest to them, build those critical networks, and really get their feet on the ground in what the work of the state government is all about. So that is a unique opportunity. It's very exciting. We also have a program called the Governor's Fellows Programs every summer. It's a highly selective program, but individuals either in college or just coming out of college have the chance to work directly in critical secretariats. We have two fellows in my office, and this is an opportunity for us to give a pathway to many talented young people. For me personally, mentoring and supporting young women has always been important in my life, and you know, as a college professor especially, I always participated in structured mentorship programs, both at my institutions from which I had graduated, as well as helping students in the classroom and ensuring that they had robust opportunities to begin the critical journeys in their designated career paths. So all of this is really critical, and the more we can structure and deliver thoughtful programs, we are able to support so many people that previously didn't think that they had a place or a voice in our state government.
Thank you so much. So, lots of efforts are being done. So, really effective programs. Aruna Miller?
Yes, Dr. Qureshi, thank you so much for your leadership at APPNA. And Dr. Rao as well, we're excited watching the World Cup, and we'll see where it all lands. A lot of exciting things happening.
Thank you.
Yeah, sure. Have a safe journey to where you're going. And so what I'd like to say is that, look, number one, Governor Hashmi and I have so much in common. And it's just uncanny. So let me point that out first. Governor Hashmi and I were both born in Hyderabad in India. The same year, we came here to this country almost at the same age. I believe Governor Hashmi came when she was 4 years old. I was a little late. I was following her. I came when I was 7 years old. And who would have ever thought, except in the possibilities of this country, here she is, Lieutenant Governor of Virginia, and here I am serving as Lieutenant Governor in Maryland. Sister stage right across the bridge. I mean, it is just amazing. And I can't tell you how proud I am of her being elected and the people of Virginia electing such a great leader as their lieutenant governor. And I look forward to working with you, Governor Hashmi, on many things as we look forward. Now, as far as trying to be able to get women in more of these executive roles, I will say one of the most important things is to share your own story. Right? Because prior to me being in this role, as well as Governor Hashmi, there weren't people that looked like us in these roles. So I think it's about stepping up to the plate. And I can tell you the first time that I was asked to run for office, my immediate reaction, in fact, was that I said, no, I'm not running. I'm not a politician. I'm an engineer. I have no idea what this means to be a politician. Now, I think Governor Hashmi has a different story. She actually grew up with talking about politics at the kitchen table, and it was something that she was prepared to do, but I wasn't. And so when I would go to polling places and I would meet with voters, they would come up and say, we've never seen somebody that looks like you that ever ran for office. And all of a sudden, that's all it took. It got them engaged, triggered, wanting to be more civically engaged. Next thing you know, they're volunteering for the campaign, they're signed up to vote, and then they start getting really engaged. And next thing you know, they decide, why not me? I'm going to run for office. So I think that's one of the most important things you can do, to step up to the plate yourself and to serve that role, no matter how scary it looks and that you never thought you were going to be in that role. You have to be able to do that, because as soon as you do that, you break down barriers. Now, Governor Moore and I, what we've done in our administration is we made sure that our administration leadership reflected the community that we serve in the state of Maryland. Our cabinet secretaries, 50% female, 50% people of color. This isn't to check the boxes. This is because these are individuals that bring excellence to what we do, and they are really the leaders that go into their respective communities, can engage them better than he and I can do, and get them more involved. And I think that makes a huge difference as well. When those communities see people that look like themselves in these roles, then they feel like, why not me? I can do this too. So I think it really is about stepping up to the plate, being who you are, doing things that scare you, because once you do it, other people have the courage to do it.
Thank you so much. That is very inspiring. Just seeing you two women of similar background, similar stories to a lot of us physicians in APPNA, as you know, is an organization of physicians from Pakistani descent. So we all have similar stories. And I think one of the reasons the APPNA Advocacy Committee wanted to use this platform is to share stories like you, invite people like you in leadership roles to help inspire physicians as well. And then in addition to that, we wanted to make sure that the issues and the policies that are relevant to healthcare providers, we can learn from you how to more effectively advance those issues in government. And who best to ask but people like yourselves. So I really appreciate, and I think this is going to be a very inspiring session for lots of us in our audience. So I'll move on to something similar. An additional question on top of that is that research shows that voters, relevant to both of you, sometimes face an imagination barrier, picturing women in top executive roles. How has that double standard affected your approach to advocating for policy and constituents? So either one of you can address that.
Okay.
I'll let you go first, LG
Okay.
Miller.
Sure. Well, I would say that, again, going back to the question, being in these roles really does make a big difference for people and the voters when they're looking at us. And I will say that, let me ask you this again, Dr. Qureshi. Can you repeat the question again?
Sure. It's sometimes that voters, when they look at, women of South Asian descent or just women overall, regardless of ethnicity, they see this imagination barrier. How is a woman going to lead us? So how do you sort of overcome that sort of
Yeah.
prejudice in people?
Well, I can tell you when I was running for office to be lieutenant governor with Governor Westmore, we had all sorts of people that gave us their unfiltered feedback and advice to us. In fact, several of them came up to me when we both got on a ticket. They said, conventional wisdom says two people of color on a ticket can't get elected. Those are, the type of feedback we'd get from voters. And I will tell you, what they failed to remember is that the voters ultimately decided who they thought would be the best candidates to run for office. So as much as feedback that we got that could have been very negative, there was just as many people that came back with positive, right? They didn't want status quo. They wanted something different, a different perspective on how state government should move. So in 2022, Maryland voters elected the first Black governor in Maryland's history, the first Asian immigrant lieutenant governor in their history. Not just that, but they sent the nation the first Black-brown gubernatorial ticket ever to win in the history of the United States. So as much as you get voters that are kind of status quo and they want to see the same type of people run again, there's so many more that want to see different type of candidates running. Look, our whole nation, and I can tell you here in the state of Maryland, we're majority minority, right? So the world is changing rapidly. People from all over the world are coming here and calling Maryland home, Virginia home, the United States their home. And you need to be able to have representatives that really reflect the communities that is rapidly changing. And we know the South Asian community especially is growing at such a fast rate. And I think they're excited and they want to be able to see change. So, I will say that, look, you're going to have individuals that'll always push back, but no, ultimately, most voters are going to look for the best candidates, not just how they look.
Absolutely. And Lieutenant Governor Hashmi?
I think Governor Miller just articulated so well the changing dynamic, the changing demographics, and the changing expectations for what leadership looks like all across the country. And we've certainly seen it here in Maryland and in Virginia. And it is very interesting for me personally to see the ways in which Virginia has changed. My husband and I moved to Virginia about 35 years ago. I spent most of my childhood and early years in Georgia. And when I came to Virginia, it was a very conservative state. It was really different. Virginia was the former capital of the Confederacy during the Civil War. And I live in Richmond, and the very streets here echo with the history of the Civil War and of the Confederate mindset. But in these 30 years, we've seen some really dramatic changes. And so just as L.G. Miller articulated, we made history in Virginia too. We elected the first woman to be governor in its history. We've never had a woman take the governor's role in Virginia. And for me, running for lieutenant governor, in Virginia, we don't run as a ticket. And I was responsible for my own campaign, for working my way through a tough primary. I was running against 5 men in the primary, and it wasn't given that I was going to succeed. So being able to connect with voters and see voters, talk to them directly, listen to them, that makes all the difference. And one data point that I always share is the fact that when I first started to run, I had a lot of people within my own party say to me, you might do well in the Richmond area. You're known as their state senator. I was serving as state senator for 6 years here. But when you get to the rural parts of Virginia, especially Southwest Virginia, people are not going to vote for someone with a name like yours, and even if they're Democratic voters. And I just didn't trust that kind of way of thinking of and distrust of the average voter. One thing I knew is that if I got into their localities, if I spoke to them directly, that makes all the difference. So if you take a look at the primary election and look at the counties in which I succeeded in getting majority votes, it's really evident that my being present, my being in the spaces where voters could talk to me and hear my message, that made a difference. I ended up winning in many of those Southwest rural areas in Virginia that probably had not had a lot of experience with someone of my background. And just as L.G. Miller said, it's the voters are ready for people who have an authentic voice. They're ready for individuals who are going to be fighting on the issues that impact them and their families. And that's what voters respond to. And that's why we saw some pretty dramatic changes here in Virginia and certainly in Maryland prior to this year. So I think there's a great deal of optimism in the ways in which we're seeing the landscape on electoral politics change across the country.
Yeah, no, thank you for that. I mean, I think all of your experiences are very refreshing to hear. And I think the conclusion is that not to pay heed to the naysayers, but to move forward with your own convictions. And I think the beauty of the American public or the land of opportunity is that sometimes people do listen to your message, regardless of what your last name is or what you look like. So that's very refreshing and heartening to hear. So I think what we'll do now is I'll ask each of you LGs to perhaps talk about one of your specific close to heart advocacy goals that you've had realized into policy. Some of the things that you're championing. And I'll start again, maybe this time with LG Hashmi. What is some of the things that you've championed that you've seen become policy because of your support?
Well, thank you. Legislatively speaking, when I was in the Virginia Senate, I focused on key areas primarily around education and healthcare, housing, labor issues, as well as the environment and energy concerns. One area that I'm really proud about is that in my first session in office, I carried and passed successfully the legislation for environmental justice here in Virginia. This was a critical piece of legislation given the fact that we have seen so many instances of environmental injustice that has been harmful, particularly to low-income communities. And when we talk about environmental justice, we're really talking about healthcare protections. We're talking about the kind of particulate matter that we have in the air that just harms so many communities with increased rates of asthma and with heart disease. We're talking about pollutants in the water and in the soil that increase the risk of cancer for children and for the elderly. So passing the Environmental Justice Act has meant that anytime there is a siting that's proposed for industrial usage, for waste matter that can affect our communities, the issues of the surrounding localities have to be taken into consideration. So I'm especially proud of that work. I'm proud of the kind of investments I've been able to champion and bring into Virginia's public education system. I carried the budget that brought in 1 year well over $2 billion, and then the next year close to another $1 billion of investment into public education to improve the opportunities, particularly particularly for students from low-income communities, our English language students, and our students with special needs. I've also been working in many healthcare spaces as well. I chaired the Senate Committee on Education and Health, and working particularly on renal disease, knowing how it impacts many of our vulnerable communities that don't have access to preventative care has been important. So we've been able to ease some of the challenges that living donors face to address the need for living donors, particularly around diabetes and renal disease failure. We established the Renal Disease Advisory Council so that we can especially target the vulnerable communities who don't have hospitals and clinics nearby. So those are some of the examples that I've been really proud of being able to work on and get some achievements in these last few years.
Excellent. And LG Aruna Miller, would you like to talk about some of your causes that you've championed?
Thank you so much for that question. And yes, being a former legislator and now on the executive side, I'm really honored that I still get to work on policies that impact people's lives. And one of the areas comes and stems from my own technical background, being a civil engineer. So I've spent over 25 years of my career as a transportation engineer, trying to build safe infrastructure for our users. So in 2023, we had a devastating crash that happened on Maryland Highway, and it involved two drivers that were exceeding the speed of 100 miles an hour near a work zone, crashed into the work zone, and killed 6 construction workers that day. It was the largest loss that we've ever had in a crash in a work zone in Maryland history. So as soon as that happened, Governor Moore set up a work zone safety group, and I chaired that group. We met with leaders all across the state in different industries, construction workers, engineers, labor groups, and we came up with recommendations, policy to make our roadways safer, not just for drivers, but also those working on our roadways. And we passed a legislation that was called the Road Worker Protection Act. Essentially, that is to be able to educate the public more, engineer our zones so they're more safer for the workers, and to have legislation that actually gave greater enforcement. So prior to this, what happened is when people were speeding near work zones, the ticket was $40. That's it. I mean, that's not enough to deter most people. So we increased that amount to $80, but that still doesn't seem like a lot. So we actually created a situation where it's tiered. So based on how much over the speed limit you're going, the penalties are going to increase that much more. So you can get a ticket for $1,000 and get time in jail if you're exceeding, like going at 100 miles an hour. So we really believe that that has been very effective. We've seen roadway fatalities as well as work zone fatalities coming down significantly since this bill has passed. Look, there's still a lot more work to do because we continue to lose the men and women who work at these construction sites. And I know that because I work beside them as an engineer. And honestly, they put their life on the line every day that they're on the roadways working as cars are whipping by them. So I ask everybody that's listening, please, when you see a work zone, drive slowly, pay attention, move over when you see emergency vehicles there, so you give them enough space to be able to do what they need to do, and always obey the speed limit. Another area that I worked on, and this is when I first became a legislator, but eventually the bill passed, and that is to have paid family leave, right? So when I first got into the legislature in 2010, I presented a bill to say, hey, we need to have paid family leave. Here's the thing, when women have children, at that time, it was either you had to take vacation, you had to take comp time, or you had to take sick leave in order to have a baby. Look, I can tell you, having a baby is not a sickness. And for every woman that's ever had a child, it's no vacation. Okay. So when I actually presented this bill among our, Maryland General Assembly, you would have thought I landed from Mars, to what? Paid leave? Are you kidding? Come on. But you see how much progress this country has made since 2010 to where we are today. Maryland actually has a bill, 12 weeks paid leave that employers and employees pay into. And what a difference this is going to make. It's going to be implemented in about one more year. This will be able to get particularly women who tend to be 75% of the caregivers at home to be able to, pursue their careers instead of taking this time off and possibly losing their jobs. This will actually give them paid time off. You get to spend time with your child, which is so critical to their well-being, in fact, the well-being of both parents. And it's not just about having a birth of a child. It's also to be a caretaker. You may have an elderly parent that you live with. My mom lives with me. So if anything happens to her, then I can take 12 weeks off as well to care for her. So I'm really proud about, of both of these policies to increase safety for people on the roadways, as well as to guarantee paid leave to be able to take care of our loved ones.
Thank you so much.
Can I
Very
just say,
important. Yes,
Can
please.
I just say thank you so much to Governor Miller for doing that. I think Virginia is following Maryland's leadership here. We just passed a similar bill, and we were able to replicate what Maryland has done under LG Miller's leadership. So thank you so much for paving that pathway. We got it done in Virginia too.
I'm glad to hear that, Governor Hashmi, and I would love to take the credit, but it was after I left the legislature that the bill actually passed because of the great partnership we have with the Maryland General Assembly. I may have been one of many people that introduced it in the past, but look, it made it across the finish line, and as you know, progress is incremental. Some of these bills, we can tell all the people that are listening, take decades to pass, believe it or not. It doesn't really happen overnight, right?
Yeah.
Well, as a Marylander, I'd like to thank you as well for that. So coming to the fact that our audience is primarily physicians, so we're very close to our heart are things that you've done specifically related to providing affordable health care to all. And I know LG Hashmi has done some work. It was in her bio. So would you like to expand on that a bit, Lieutenant Governor Hashmi?
Yes, thank you. And the issues around healthcare are certainly central to the work that I've been doing. In addition to chairing the Senate Committee on Education and Health, I have served as a member for the past 6 years as a member of the Senate on the Joint Commission on Healthcare, and served as vice chair on that as well, and also part of the Healthcare Workforce Development Authority. Those areas in particular have enabled me to work on issues such as making sure our rural communities have accessible and affordable health care. I know that we are all facing a crisis now, given the realities of H.R. 1, and it is particularly devastating to see this roll out and impact the communities that we've been trying to work assiduously to support here in Virginia. For the past 6 years, a clear focus of the JCHC has been on delivering effective healthcare services to rural Virginians. And the challenges that so many of our communities face are not just access points, even though that is critical, but the ability to have providers. We don't have enough physicians, we don't have enough nurses, we don't have enough mental health support services in these areas. So we have really focused in Virginia on expanding telehealth services, on bringing mobile clinics to localities, and on making sure that we have better and more effective medical transportation for those vulnerable individuals who can't reach their necessary care and support services. We were on on a good path, I believe, over the past several years. And what is happening now with H.R. 1 and the anticipated huge cuts to Medicaid expansion, which we were able to leverage in the Virginia marketplace and provide insurance to over 800,000 Virginians. All of that is in jeopardy. So at this point, the state is working to try to plug in some of the gaps from the loss of federal dollars into expanded Medicaid funding. But we know that the state can't keep this up for too long. It is a huge cost to us, which is going to ripple out into our other healthcare services, affecting not just rural Virginia, but all Virginians. It's going to affect our ability to attract and keep the kind of medical providers that we need to have here in Virginia. So those are areas of concern. You mentioned reproductive health care. That's an area that I've been working on quite a bit over the past several years. We have finally passed the Right to Contraception Act here in Virginia, which guarantees the right to access and use contraceptive medication as well as devices. That is an area that I feel that we're going to see some further attacks, whether it's from the federal government or within our own state assembly members. We've also passed twice now, as is required, the constitutional amendment to protect reproductive health care. That measure is going to be in front of Virginia's voters this fall, and hopefully we will inscribe into the Virginia Constitution protections around abortion care and broader reproductive health care. In that regard, Virginia is the final state in the South to provide safe and legal access to abortion. And what we have seen now is what I call medical refugees. We see people from so many other states crossing state lines in order to receive the care and the support that they need. And so given the decision, Supreme Court decision that rolled back access to abortion care, this is something that Virginia has really taken seriously, and we are going to continue to work on. I mentioned already my work on the renal disease area, so that's something I will certainly continue to focus on, and making sure that our most vulnerable communities have greater access to preventative care so that we can stave off the crisis of diabetes and renal disease that affects so many in our communities.
Thank you. And Lieutenant Governor Aruna Miller, I know that you mentioned, or we mentioned in your bio, you are on the Maryland, you chair the overdose response team.
That's right. That's right, Dr. Qureshi. So the Maryland Office of Overdose Response, the acronym is MORE, not as in Westmore, but MOOR. That is in the Lieutenant Governor's office. And I will say that we have just promising news on that. We've seen overdose fatalities decrease to their lowest level in the past 10 years. So we are really making an impact. By the way, we're providing preventive care and opportunities, where, we need to destigmatize people that are suffering from overdoses and why are they choosing substance use. Well, many times it has to do with the fact that they're suffering from trauma or mental health or other, situations that happen that warrant them to lean into these substance use disorders. So the first thing we're trying to do is lift that stigma, and I try to talk about it as much as I can. As a matter of fact, when I talked about earlier sharing your story, I actually have a loved one in my family that died as a result of opioid overdose. So I share that story as often as I can, because once you do that, then other people feel more comfortable to come forward and share their own stories. And when they do, then we can actually provide them with the help that they need in order to reach recovery. We also are doing what's called work-friendly places, where basically individuals that are suffering from opioid addiction, that we're going to make sure that the workplaces are friendly, that allow them to take some time off in order to make sure they can get the treatment they need. Again, when an individual spends close to 8 to 10 hours at a workplace, the workplace becomes a powerful area for recovery, treatment, and really forgiveness from the whole environment of individuals that are working around them. Another thing that we're looking at is Black women are twice as likely to die from pregnancy-related causes and experience maternal near-miss events, right? And as many of you in APPNA physicians, you probably know that hypertension is a leading cause of death among Hispanic women, and closing these gaps requires great leadership. And we have that with our Secretary of Health right now, Mina Sheshamani, and she's doing great work trying to address this by, we're making, taking decisive action by partnering with reproductive health clinics to improve hospital care for Black women. We're expanding Medicaid coverage for prenatal and postpartum care, regardless of immigration status. And we're supporting women with histories of substance use. And I think all of these factors, and I'm sure many of you as physicians here can offer much more than this, but there's a lot of tools in the tool shed, and we're working towards that. But again, it requires leadership, people to recognize these problems. And I think that's what you have, once again, when you have diverse leadership, to be able to be the voice that recognizes these gaps that we're seeing right now in the healthcare system. And reproductive care, to Governor Hashmi's point, Maryland did pass a bill to enshrine reproductive rights in our Constitution. Very proud of that. Overwhelmingly supported by Maryland voters with, I believe, 75% of the vote. And then, of course, Governor Moore and I, when we first entered office, the previous governor refused to release funding to provide abortion care. He was withholding $3.5 million, despite the fact that the General Assembly had passed it. He can withhold the money. On day one, when we were inaugurated, we came and released that money. So it is very important to us that women have access to reproductive care and rights.
Thank you so much. Very, very refreshing to hear that. And, as a physician, all the things that you are both doing in your respective states regarding healthcare, promoting women's right for reproduction, care, reproductive care, as well as contraception. So, Lieutenant Governor Aruna Miller, you also very wisely are doing things in the area of mental health, and that ties in with the overdose response that you just mentioned. So now coming to more something in your personal capacities, if you'd like to share an anecdote from your experiences that highlight a challenge you faced specifically on a personal level and how you overcame it because of being a woman or a minority, a challenge related to that. If either one of you would want to share.
Sure, I'm happy to take that question. Look, I think you can ask any woman and any minority, and we face all sorts of obstacles and anecdotes that we can share. And I can tell you from, coming here as an immigrant, I spent my entire life trying to fit into spaces that weren't created with me in mind, right? Number one, coming here, not knowing the language, growing up in the Midwest, I always stood out, right? Here I was, the brown kid with a funny name that no one could pronounce, Aruna Katragada. That was my name before I got married. And then being a female engineer in a male-dominated field. Again, trying to fit into these spaces. And then being a Indian American legislator in a legislature that looked nothing like me. So most of my life, I always thought the assignment was to fit in as best I could. And somewhere along the line, I realized that's not the assignment. The assignment is to walk into spaces that don't look like you to make sure that those that walk in after you feel comfortable in those spaces. It really, I would walk into rooms and feel like there's nobody here that looks like me. Maybe it's a sign I'm not meant to be here. It's not a sign you're not meant to be there. It's a force telling you you have to be there to make it better than when you found it. So I realized that, and I can tell you every single time that I ran for office, there were always people telling me that I shouldn't be running, right? The first time I ran for office, and again, it was a time when I wasn't comfortable to run. A gentleman came up to me and he said, "What's a nice girl like you doing in the business of politics?" Right? And I looked at him and I said, first of all, the business of politics is very much my business and everybody's business, because that's where laws are passed that are going to impact me. And second of all, I'm not that nice. You can ask my teenage daughters, they'll tell you that. And the second time I ran, I had my opponent tell me that he was going to bury me under the amount of money that he was going to use in the campaign. Sure enough, he used over $13 million when I ran for United States Congress, and I had probably raised about $1 million. He didn't bury me, but I came in second place, but I certainly made him spend a whole lot of money. That's what I can tell you. And of course, the third time I ran, as I described earlier, people coming and telling us that two people of color could never get elected. So these are stories, war stories that each of us has. But the biggest thing to take away from that, again, Governor Hashmi talked about it earlier, is that when the voters meet you and people meet you and they know who you are and they know how authentic you are, and if they can trust you, all of that doesn't matter. The color of your skin, your gender, your ethnicity, your religion. I really believe people come from that space, most people. There's a few that'll come from different spaces, and that's okay. It just makes us work that much harder.
Very inspiring. Just listening to both of you, I'm inspired. Excellent, excellent. I'm very, very happy that we were able to coordinate with your schedules to do this very, very significant webinar. Lieutenant Governor Hashmi, anything to add or anything of your own to share?
Those are the challenges, as Governor Miller shared, that are really across the board for a lot of women candidates, especially minority women candidates. And I can share some personal challenges. Every day is a challenge, frankly, especially when you are a candidate. And even though I grew up in a very political household, my dad taught political science, and he was a professor of American government. So that was always the talk at the kitchen table. It was never expected by anybody that I would enter into the political space. Because my dad was an academic, I saw my career in academia and pursued a college teaching career and spent 30 years almost in higher education, teaching American literature. And I hadn't planned to run for office. I heard, Aruna, you said that you were asked to run, and I'm so jealous of that, because every time I've run, nobody has asked me to run. And in fact, they've told me, sit down, it's not your turn, or you're not the right person. And that's one thing I would share with people, is that don't wait to be asked, because if you wait, sometimes that request will never come, because a lot of times people don't envision folks such as L.G. Miller and I being in these spaces. We have to help people see and appreciate that we do belong in these spaces and are actually able to do this necessary work. So I didn't wait to ask. When I felt that I needed to run for the state Senate seat, I just decided to do it on my own. So the biggest challenge was that I was completely new to politics. I didn't have a donor network base. This was going to be the state Senate run, I was told, was going to cost well over $1.8 million. I didn't know where I was going to get that kind of money. I didn't have any sense of how to build a political apparatus to help me get elected, the volunteers, the work, and all of that. So I just started to do it. It was a mom and pop kind of a venture at first. My husband and I slowly starting to learn and teach ourselves, and then the network starts to grow. You've got a young woman that you already introduced, June Laffey, on this call. She was among my first folks to join as a field organizer. So, counting on campaign teams that are professional, working with volunteers, all of these concerns matter, but it's hard work. It's hard if you're new to the political space, and it's hard if you are trying to build a core identity in ways that no one else had anticipated. When I decided to run for lieutenant governor, someone whose opinion I really trust came to me and said, Ghazala, you're not going to succeed. I'm just saying this to you frankly. He said, Virginia politics is very clear. It's black or white. You are neither black nor white. People don't know what to do with you. It's just not going to happen this time around for you. And so those are the kinds of issues that, you hear, you face, and you just have to build positions of trust with a lot of wonderful people and keep moving forward and keep doing that necessary work.
And can
Very
I just,
glad. Yeah, go ahead, please.
Dr. Qureshi, can I just add one bragging right on Governor
Please.
Hashmi? I believe when she ran for state senator, if I'm not mistaken, Governor Hashmi, you flipped a red district that was red for 40 years.
Yes.
She
Yes.
flipped it to blue, and then ultimately that led to having the majority, right, on the
Yes.
Senate in
The
Virginia.
one seat majority.
The one seat. So that's pretty remarkable.
Absolutely. So true trailblazers, really well defined, really, really trailblazers. So what I'd like to ask you as physicians, most of our audience, all of the APPNA community are physicians. Learning about some of the efforts you've done in your respective states for healthcare, providing healthcare to the underserved. How can we as physicians, and we have physicians, this is a national organization all across North America. So we have physicians in every state. And since I have both of you LGs here from Virginia and Maryland, how can we local physicians to each of these respective states help more effectively deliver our volunteer time to help serve the underserved population as far as healthcare is concerned? How can we more effectively coordinate, liaise with you to do that?
I would love any opportunities to collaborate and build those kinds of opportunities to provide critical and necessary care. I'm very impressed by the ways in which APPNA is already doing that. I've seen APPNA take a leadership role in the free clinics that are stood up, the free clinics that are connected to some of our faith communities, and the ways in which care is being delivered. Certainly here in Virginia, I've seen many outreach efforts, and the more we can do that, it is absolutely critical. Everyone on this call knows that we're going to face a monumental healthcare crisis, given the cuts that we are seeing from the federal government. And while this country should not by any means rely on the goodness and volunteer efforts of people to carry us through, that's what's going to get us through this crisis. And I also think we all need to be fighting for universal health care at this point. We've seen the devastating toll that increasing medical costs have on individual families, the inability for individuals to actually cover these costs, the ways it impacts the entire profession, and being able to provide healthcare to everyone as a fundamental human right is something that I think every voice is going to be critically important in the next decade or two if we're going to change the direction of healthcare in this nation.
And LG Miller, would you like to sort of advise us how we can better liaise at a state level?
Thank you so much, Dr. Qureshi. And Governor Hashmi is right. Healthcare should be a human right, period. Everybody should have healthcare. And I hope that I am alive to see Medicare for all at some point in our nation. I believed in that from the first time it was introduced by Bernie Sanders, I think it was. He was the one that was championing it at least like 10 years ago or longer. And I would love to see that. Look, number one reason why Americans go into bankruptcy is because of healthcare costs, right? Because they can't pay the bills once they're admitted to a hospital, whatever it may be. They didn't have health insurance, and the list go on. And health insurance, unfortunately, is directly tied in to your job most of the time, right? So I would love to be able to see a situation where we can have similar to public schools, right? There's always a seat there for your child when you get there. You don't have to pay into it like an insurance, but as a taxpayer, you're paying into the collectiveness of making sure every child is educated in our country. Healthcare should be the same way. We benefit when Americans are healthier. So I want to thank APPNA and every one of the physicians for the many ways you do pro bono work, the way you do the free clinics. Please continue to do that as best you can. And the question that I would ask you is, what can Governor Hashmi and I do for you to make your jobs better so you can better serve your patients, right? Because I'm not a medical doctor. I don't know it. So I need you all to call me up, write me an email, say, here's a policy idea I have. Here is a way in which we can really help those that are living in rural areas or underserved communities. Please let us know how we can help you. And I can tell you that when I was a legislator before, almost 80% of legislation that came to me came from my constituents, because they're the ones who are facing the hardships, and they would come to me and say, can you do this? We would try to resolve it just by working with the various departments, and we couldn't resolve it because they said, oh, well, that's not part of the law. We don't have to do that. Then guess what? I would introduce a piece of legislation to make sure it was part of the law. And then finally, what I would say is, besides all the doctors and APPNA members giving us advice on what we can do to better serve you, please go out and vote. Because look, when you all don't take the time to vote, people who do take the time, they're representing your voice every time they go and vote for you if you don't do it. So if healthcare is so important to you, then you should be sure to vote in every primary, in every general election. And I know it's not easy to navigate politics, the various offices, federal, state, and local, but there are organizations out there that can help you navigate to understand that better, and they'll have a sample ballot. So look for the candidates that are pro-healthcare, and those are the type of individuals that match your values that you should vote for.
Yeah, absolutely. And today's platform is just an example to share with both of you that coincidentally, physicians are the profession that are most actively civically engaged. So
Good.
not only do they contribute their time in providing, free services and volunteering their time for the underserved population, but they, surprisingly are very civically engaged. And I think forums like this help us continue that effort and that mission. What
Uh,
I'd like to
If
ask
if I
you,
could just say, Dr. Qureshi, I think we have a record number of physicians actually running for office
Mhm.
this year and in upcoming elections. I've seen a large number running for Congress, and certainly at the state and local level. In Virginia, I'm getting outreach from physicians who are interested in engaging in this space, and so I encourage you don't always have to run for office, but if you got something to contribute and you want to play a role, always encourage people, if this is a path that they're thinking, there are certainly opportunities for physicians to be in public office. Our former governor, Governor Ralph Northam, is a pediatrician, and that medical expertise was absolutely critical as Virginia faced COVID. And we need more. We need more doctors. We need people from a variety of professions in government so that we can make decisions in a manner that is based on expertise that is so critical.
I could not agree with Governor Hashmi more. Yes. If there are physicians in APPNA, please consider running for office. Governor Hashmi and I are happy to share whatever knowledge we have so we can make that path that much better for you.
Thank you so much. And just as an example for awareness purposes, APPNA is uniquely qualified to represent the physician voice, both at the legislative level as well as the advocating for specific policy level. As you know, the Advocacy Committee specifically within APPNA did lots of strides and lots of measures, lots of campaigning to help address the recent visa restrictions that were imposed at a federal level. So we've had some successes, and we did that exactly by utilizing our platform to get the message out there and to collectively work with the relevant legislators. Another question I'd like to ask, and actually it's coming in from one of the attendees, so I'll read that out. We have an attendee, Dr. Haroon. He is actually a psychiatrist himself. His question is to both of you, Honorable Lieutenant Governors, that as a Alzheimer's physician, his question is that Maryland's population is aging rapidly. What plans does Maryland, and of course, I'll also ask Lieutenant Governor Hashmi, what are you doing at state level to prepare for the increasing number of people or residents living with Alzheimer's disease and related dementias? So something coming appropriately from a psychiatrist who's doing work in Alzheimer's.
Well, first thing I want to say is thank you for being in this space. And he's absolutely right. The aging population continues to increase. I know that in the state of Maryland. And believe it or not, we actually have a Department of Aging. That's how important the aging population is to Maryland state government. And the whole focus is to be able to address the needs of our senior citizens. And there are many different needs, including those that are suffering from Alzheimer's. It's a very complicated disease. And I would like to say that, I have suggestions to offer, but I do not. So again, we would rely on physicians, psychiatrists, to be able to let us know what's best that we can do to serve you in order to meet the needs of Alzheimer's patients. To the doctor that asked that question, I'm happy to take this call from you if you'd like offline, and really connect you with the individuals, not just our Department of Health, but also our Department of Aging, to be able to, understand a little bit more from you so we can better serve our senior citizens. And it's not just that, but it's also affordable housing. It's also making sure housing can accommodate the disabilities that oftentimes come with senior citizens. In fact, my understanding is it's almost 25% of the population across the United States that have some form of disability. And so we need to be very cognizant of that and to be able to make sure our housing meets those needs, our transportation meets those needs. I can tell you, being in the transportation field, when the ADA law was passed, we made a big concerted effort to make sure we had curb ramps, right? You think, what's the big deal about curb ramps? You need to have them in order to make sure wheelchair users can access sidewalks and be able to be mobile as best they can. And here's the thing, when we do anything that impacts the disabled community, chances are it impacts all our lives for that much better. For those that are hearing impaired, right? We now have closed caption that's available on television. I can tell you, I don't watch any movies or any TV without closed caption because half the time I can't even hear, what is being said because sometimes the audio is just not that good. And so there's a lot of things that come from being able to address the needs of one community that has a trickling effect that is benefits for the entire population.
Thank you very much. I think the poser of that question is also sending his thanks. Uh, Lieutenant Governor Hashmi, what about in the state of Maryland? Anything being done to proactively prepare for the aging population?
Yes, this is an issue that's deeply personal to me. My mother-in-law suffered from Alzheimer's, and we had such challenges finding care for her, effective care. And that's partly in connection to the fact that a lot of our medical services are not ready yet for the kind of language access that we need, that we don't have care that is reflective of cultural competency that's so necessary given our diverse population. So one issue that we faced, my husband and I, as we tried to take care of his mother, is that finding services that could address her loss of memory, which included the loss of English language facility. She no longer could speak English, and we could not find care that was reflective of her need for a caregiver that could speak Urdu and understand what it is that she needed. So it's a challenge all across the board. It's a particular challenge for many in the immigrant communities as we have aging population. So similar to Maryland, Virginia also has a Department of Aging and Rehabilitative Services that is focused on serving our aging communities. And we did establish a while ago, I think about 3 years ago, we established a dementia state plan, which is to take a look at the aging population and the critical needs and services that are part of what our aging communities are going to need. People are living longer, but also needing increased services as a result. We're focused on developing opportunities for aging in place so that more individuals can live longer in their own homes and be supported by family as well as caregivers, and being able to support those who are providing the care is so critical when you have family members who are taking on the full-time role of caregivers for their elderly loved ones. We need to be able to treat them as caregivers. They need to have an income. They need to be paid as home health care providers and be recognized in that capacity as well. So those are some of the steps that Virginia has already taken. And then the Virginia Memory Project is also focusing on issues of dementia, Alzheimer's, and better understanding, better data on where we can direct our critical state resources. So all of that is top of mind for many of us here in Virginia.
Thank you for that. So good. That's very good to know. I think good knowledge sharing, because I think some of us didn't know there was a specific Department of Aging. So I think we have a question from one of the audiences. Dr. Shazadi wants to know from both of you, was there a specific leader who inspired you, or a specific personality that inspired you to enter into this field as a leader? Any individual, or was it self-motivation?
I'm happy to answer that question. So, of course, I'm an immigrant to this country, and so I became a U.S. citizen in the year 2000. And I went and voted for the very first time. And I was so overcome with emotions. I remember being in the polling booth crying and thinking, wow, this is what it means to be an American. I get to vote. I get to decide the fate of our nation, our country. This is so exciting. And I'm feeling really good that I voted and I did everything that I was supposed to do because that's what the radio said, that's what the newspaper said. Come out, and my candidate, Al Gore, didn't end up winning. Actually, I like to debate that. I think he did, but the Supreme Court handed the election over to George W. Bush. And so you can say in many ways that George W. Bush was my inspiration to get more engaged and run for office. No, but really, the reason why I did it is because I realized, oh my gosh, here I went and voted. My candidate didn't win. And I saw the direction our country was going. All of a sudden, we're in a war that we should have never gotten into. And I'm seeing all this happen. And I'm like, look, there's a lot more to this than just voting. So I picked up the phone, called up the Democratic Party, and said, look, I have no idea what you all do, but how can I help? Because I really need this country to go in a better direction. And that's how I kind of started off. And so there was a lot of people that got me engaged, that taught me what I know today. Many of them are women who stepped up, tapped me, and said, you need to consider running for office. And they were the people that I said, no, I don't think I'm ready to run for office. But they were with me every step of the way. And then I would say also my dad and my husband. My dad came here and he was a trailblazer in his own way. He was the first person in his family to come to the United States. And he took on a lot of responsibility when he brought my siblings and I and all of us here. He was a sole breadwinner. And I think that because he was such a risk taker, that always inspired me to take risks. And then, of course, my husband, who from day one, I think Governor Hashmi said, you can't do this work if you don't have a partner that is 1,000 beside you, behind you, in front of you, wherever they need to be, because this is a family affair. You need to have them completely on board because it takes a lot of sacrifice, a lot of time away from family in order to do this, profound work of being a representative.
Thank you. Lieutenant Governor Hashmi, any
Um,
inspirational figures?
sure. One thing I always cautioned my own students is that never dive into a cult of personality, never be so amazed by individuals that you adhere to their viewpoints or their philosophies 100%, but look and learn from the people you do admire. So while I can't say that there's a person that has always been inspirational to me, their values and their actions of certain individuals that have been clearly inspiring to me throughout my life. And if I'm thinking in the political terms, then my all-time favorite president is Abraham Lincoln. He was a very flawed human being, but a charismatic, thoughtful, and strong individual who carried this nation through the most critical moment of its crisis. This nation survived, I firmly believe, because of the leadership provided by the vision and also the words and the actions of Abraham Lincoln. Similarly, in more modern times, I've always admired Jimmy Carter, who many people point to as a failure as a president, but what a remarkable individual he was. I was a kid in Georgia when he ran for office, and as Georgians, we were so proud of Jimmy Carter. But it is the work that he did, both in the presidency, I would argue, as well as in the aftermath of compassionate leadership real dedication to humanitarian values and a courage of being able to acknowledge his own flaws and an ability to stand up for what is right, even when it wasn't politically expedient. So he's someone that I have always respected and admired in so many ways.
Okay, thank you. I think this brings a more sort of a personal flavor. We get to know you more as an individual level, and all the more impressed with your ways of thinking and your background and what you've achieved today. So here's a question that I've often encountered from the people that I've sometimes volunteered with for health clinics. So oftentimes when we want to do a health clinic, the logistics become quite difficult as far as how to arrange the malpractice insurance component of it. So is there something we could possibly do coming up as a policy, as a legislation that would cover physicians who perform volunteer work so that they have this umbrella policy to cover for malpractice? Is there something like that that could be possible, you think?
That's a really good question, and I hadn't even thought about that. But the issue of malpractice is front and center here in Virginia, and we've had some debates. I think the whole concerns around malpractice insurance needs to be overhauled. We are establishing a study commission this past session, just passed that legislation to establish the commission. So there's clear need to evaluate the ways in which physicians and their opportunities to provide services are harmed and affected by malpractice concerns. I will carry this request to that new commission and ask them to integrate it into their analysis this upcoming year so that we can have some good answers for you. Thank you for sharing that concern.
Yeah, thank you. That would greatly, greatly facilitate our performing that free service because the logistics become quite hairy, when you do it. Sometimes you have to do it towards one physician's office, who then temporarily you have to do so much administrative paperwork. So if something that could ease that aspect, I'm sure we'd have many, many more volunteers. So do let us know. I look forward to a follow-up on that or how we can further this cause.
Yeah, I think
So
that's a really good question that you raised, Dr. Qureshi. And I never heard of that either. So please let me know what we can do
sure.
on the Maryland side as well. It almost sounds like it's like the Good Samaritan law, right? We have that for many situations. I can tell you with the opioid overdose, when you see an individual and you give them Narcan, you're trying to help the individual. We have the Good Samaritan law that says that you're not going to be held responsible if something happens to them or so I don't see why we cannot be exploring this as well when it comes to physicians being able to do pro bono services and not being tied into the malpractice situation. So please let us know how we can help.
Thank you. And you got it spot on. You verbalized that excellent. That's exactly what we're looking for. So thank you. Certainly we'll be reaching out to both of you in that regard. So we have, I think we're towards the end of our allotted time for this session, and I can't thank you ladies enough. I am greatly inspired on a personal level from you, and I'm sure all of the female physicians as well as male physicians in our listening audience today are inspired. So in our questions later on, when if we ever become leaders, I think we're going to name both of you as inspirations.
Dr.
So
Qureshi, I just want to correct you. You are leaders right now. Okay, please know that
thank
1000%.
Thank you. That's very kind of you. Here's another question from the audience. We have a question from Dr. Lalarok Malik. She's asking any thoughts from either one of you on a state level healthcare for all sort of idea, if that's something that's you're looking at down the road.
Again,
That's what,
I'm sorry, go ahead, Governor Hashmi.
You please go ahead.
Okay. I would love to see something like that happen. And most of that starts within the legislature, right? And Governor Hashmi and I are on the executive side. That's not to say that we can't do legislation as well. She actually has the benefit of being the president of the Senate. Is that right, Governor Hashmi?
Yes.
Yeah. So I don't have that in Maryland. There is no prescribed role for the lieutenant governor other than to serve in the absence of the governor. Where on the Virginia side, there is in the Constitution specifically citing what a lieutenant governor does. So would be, happy to help in any way. So, please let me know what we can do.
Thank you. Now, we have a question. Yes, I'm sorry. Go ahead, Lieutenant Governor Hashmi.
I'm sorry, I was just going to share, it is a challenge to provide healthcare for all at the state level. And we really look to our federal partners to push the needle on that. And, we've seen the failures, decades, the reluctance, the incompetence, the inability. I'm sorry, I get angry when I talk about our congressional leadership in many ways, their inability to act on something. We came very, very close, of course, to enacting some good legislation through what is called Obamacare, the Affordable Care Act. That enabled us in Virginia to expand the Virginia marketplace. We were able to, as I shared earlier, provide coverage to over 800,000 Virginians who were previously uninsured. That's the kind of leadership we need. We need strong, effective leadership at the federal level so that we at the state level are also able to build on what they are doing. There's some steps that we can take and that we have tried to take. 2 years ago, I was carrying legislation to provide health care coverage for every child in Virginia, regardless of documentation status. That's something that Utah, an extremely conservative state, had already passed. And so building on what some states have been able to accomplish, knowing that in the long run, whatever we invest in healthcare cost are going to result in massive savings for us in terms of being able to address preventative care, effective treatment, and ultimately then lower cost for everybody. So it is something that I want to fight for, but we also need to be pushing our federal leaders to take action. It's been too long in this country that we haven't been able to make the changes that we need to.
Okay, thank you. So here, sort of piggybacking on that, recognizing that the visa issues and the various, laws and rules around the restrictions that have been imposed are more at the federal level. I'd just like to ask you your views on how you feel, what do you feel about the visa restrictions, especially those that impact APPNA physicians coming to this country from all of these Southeast Asian countries, especially on the J1 restrictions, the H1B restrictions. What is your opinion on that? And how do you think, how likely is it that they will be reversed anytime soon?
Well, I can
Well,
tell you that first, I don't like any of these restrictions, right? It's unfortunate that the current administration is coming down so hard on immigrants coming to this country. I think when we do this, we're actually shooting ourselves in the foot, right? As far as our economy is concerned, as far as attracting the best and the brightest to our nation. Because guess what? This country isn't the only place the best and the brightest can go. They can go to China, they can go all over the world and have access as well. So I believe most recently, our attorney general came together collectively with other attorney generals to push back on the H-1B visa. And a federal judge actually came down with the decision that this is unconstitutional to do this, $100,000 tax basically on the H-1B visa. So he's halted that. So we're really happy about that. But to your point, Dr. Qureshi, it's not just H-1B visa, it's the J-1 visas, it's the F1 visas, all of these. We want to make sure that United States really is a place where people feel like they are welcomed here, that they can be part of this country, the economic growth, the cultural growth, the social growth. Diversity is, I know it's been said many times, it's our greatest strength. That's how you're going to be able to address the challenges of the 21st century, by having diverse voices that come to the table trying to come up with the solutions. Yes, it's handled at the federal level. And as Governor Hashmi said, we need to work with our federal leaders and really push people. And you as APPNA need to also push our federal leaders to really reform immigration. It hasn't been for the longest time. And we need to be able to, particularly when it comes to H-1B visas. I know individuals that have been on these, and they basically are there at the mercy of the employers that brought them over here. So they can't leave that company. They can't start their own companies because they're so restricted on what they can do. So it would be nice to be able to have an immigration reform to address this and to bring as many people as we can to our nation. At the state level, I know that we have an immigration affairs office to be able to more talk about how we can help those that are already in this country and in our state, and how we can best help them navigate government and how they can access services.
Thank you for that. Thank you. Anything to add, Lieutenant Governor Hashmi?
I'll just echo, this is a federal issue, and we need to have federal champions to make sure that we are doing the right thing. The current restrictions that we see are arbitrary. They're biased. They're not based on any kind of real meaningful data, and they are reflective of one administration's callous viewpoints on many of the ways in which they've been rolled out. So we have an opportunity as a country. We're facing midterms this November. We've got people running in every state that are committed to standing up and fighting for immigrant communities, fighting for immigration rights, and fighting for the right things in every sector. This is our chance, regardless of party affiliation, to actually look at the individuals who are going to stand up and not bow down to what the current White House administration has been pushing, and the great harms that this administration has imposed on the country. So November is going to be a real chance for all of us to make our voices known.
Yeah, in that regard, APPNA has been championing this cause for the easing of the restrictions. Together with we have specific committees within APPNA whose sole task is to address issues like this, such as the APPNA Advocacy Committee, the Young Physicians Committee. We've worked hand in hand with the American Medical Association, as well as other relevant national organizations, to sort of lobby for and to let them know, just with the pure data, the numbers, that should you continue this policy and not do a reversal of the restrictions, there's going to be an even more accentuation of the impending healthcare crisis, because IMGs, or international medical grads, help fill this, gap in the crisis of the lack of physician healthcare providers. So the sooner they realize that, the better it is for the nation. So hopefully that message gets across with our efforts. Before we conclude, I would like to perhaps ask each of you to give your concluding remarks, and then I'll give my own. And, can't thank you enough. So we'll start with Lieutenant Governor Aruna Miller with your closing remarks. Any pearls of wisdom in the end?
Dr. Qureshi, first of all, thank you so much for giving Governor Hashmi and myself the opportunity to speak with the members of APPNA. And I thank you so much for all of you being the healers in our world. We need you more than ever. What you provide to humanity is probably one of the most noble things, that you are there for people from the moment that they're born till the moment they leave the material world. You're there caring for them, healing for them, and I thank you all for your services. My last remark that I'd like to say is that I would love to host all of you at the State House. I don't know how many of you have been to Annapolis, and I would love to have you in the Lieutenant Governor's office. You'd be surprised how many people have never been there as Marylanders. And I know, Dr. Qureshi, you're a Marylander. I don't know if
Yes.
you have you ever been to the Lieutenant Governor's office?
I have not had that opportunity. I've been to a couple of iftars hosted by the governor, but not to the lieutenant governor's office.
Okay, well, here's an invitation to every member of APPNA. Would love to have you here. And the reason why I say the Lieutenant Governor's office is that there's so much history in it. Thomas Jefferson used to reside in the same office I'm in right now. So you can just imagine how profound it is every day when I walk into that office. And I want all of you to feel that too, that this office doesn't belong to me. It belongs to every one of the voters in the state of Maryland, every Marylander it belongs to. So that's why I want you to come visit, even if you live in Virginia. I would love to have you over on our side. And then you can check out, I'm sure Governor Hashmi's office as well, which is, I'm sure, beautiful as, similar to the Maryland side. So please, would love to have you there. And again, thank you for having us.
Thank you. Lieutenant Governor Hashmi.
Well, thank you, Dr. Qureshi, for this opportunity to have this conversation. It's just been wonderful to share some thoughts, and really appreciate everyone who's joined the call. And as Governor Miller just said, I echo that sentiment. We need people to be involved. We need people to actually visit our state houses to understand how state government works. State government has a more direct impact on your patients, on your families, on all of our communities than the federal government does. It's actually where we're making decisions around our schools, around healthcare services, making decisions on the roads and the bridges that are available. All of these critical issues are so much a part of the work that we do in state government, and your voice is necessary. We see a lot of groups come through during session, but when we're not in session, that is also a good time to have more reflective and thoughtful conversations. I would welcome having meetings. My office is always open to having those kinds of meetings, whether in person or in Zoom, to consider policy proposals, to think about necessary budget ask. And much of that work is done during late summer and early fall before the session begins in January. We would welcome people to come to Richmond and to visit the Lieutenant Governor's office. LG Miller, it's not just some Virginians who have never visited the Lieutenant Governor's office here. It's actually my own colleagues in the state Senate and in the House of Delegates that have never visited. And so this past session, as I entered into this office, we made a point of opening the doors and welcoming people. And I think we had close to 1,000 visitors these past few months. So please feel free to reach out and come see us.
Thank you. And so I'll make my concluding remarks by thanking both of you, Lieutenant Governors Miller as well as Hashmi. Thank you so much for the gracious invitation. We certainly will take you up on that. I think we'll come and visit and propose some detailed policy suggestions that we can pursue relevant to physician community here in order to help facilitate our volunteer pro bono work as physicians. I also want to invite both of you to future upcoming in-person APPNA events. I think our physician community would benefit greatly, both from you as female leaders, as well as, sort of leveraging your positions with asks from us as far as healthcare related policy that you can further in your respective states. So thank you so much. And I will keep in touch with June and Rachel in order to extend these invitations to you for in-person visits at APPNA events. Our members would be greatly pleased to meet both of you in person and further discussions. So thank you very much. I look forward to future sessions like this with both of you on different topics. And absolutely thank you for your time on a Saturday morning. I'm very humbled by your attendance. Thank you very much.
Thank you. Bye.
Thank you.
Happy
Bye-bye.
Juneteenth to everyone.
Thank you so much. Thank you.
Take care. Bye-bye.
Bye-bye.